Understand your Medicare? What does Part B of Medicare cover? How much does it cost? How do I avoid a penalty? Well, stay tuned as I go over that and a couple more answers on your Medicare. Hi, I'm Matt Ragudo from UnderstandMyMedicare.org, a movement to empower Medicare beneficiaries and their loved ones to make informed and educated decisions on their Medicare. Now, if this is the first time you're listening to me, again, my name is Matt Ragudo. I am a chartered retirement planning counselor, and I am certified in long-term care planning. Here on my channel, I give up-to-date resources and information on Medicare. So if you like that, have more questions, please subscribe to listen and watch more of my content. So now into the first topic. What is Part B of Medicare? Well, Part B of Medicare covers things like doctor visits, lab work, x-rays, everything outside of the hospital. Now, Medicare is an 80-20 plan for Part B. So what that means is if the bill for your service is $100, you will pay $20. That is the 20 portion of the 80-20, while the other 80% is handled by Medicare. Now keep in mind that as of this video, 2020, you will have a $198 deductible on all of those services. So before you pay the 20%, you'll have to pay 100% of those costs. So going back to my example, if it indeed was a $100 bill you received on the 1st of January of 2020, you actually would have to pay for all of that until you met that $198 deductible. Now, part number 2, which possibly could have been part number 1, but let's just jump right into number 2. How do I enroll in Part B and how do I get it? Well, in order for you to enroll in Part B, you have to meet certain criteria. And the first one is you have to reach the age of 65 or have a disability in accordance with Social Security disability and be on Social Security disability for 2 years. Now, how do you sign up? Well, there are a multitude of ways. I've linked some in the description below. It's either one, you go on the Medicare.gov website and enroll that way, which is the more preferred way for for Medicare, or you give them a call. A lot of times if you're enrolling after you're 65 or perhaps they don't have all the records that they should have at the office, you may have to go down there to your local Social Security office where they will go ahead and verify and help you enroll in Medicare Part B. Quick note for those of you gonna get Part B of Medicare, if you have an HSA, that's a health savings account, you might want to consider speaking with your employer or whoever administers that HSA, because HSAs and Medicare Part B, while they can work together in some instances, there are nuances that I won't talk about in this video, but I'll go on in another video on how the HSAs, health matching accounts, all those employer administered accounts for health will change if you do go on the Medicare program. Now, let's go hit number 3. So how much does Medicare cost? Well, for most of America, if you're 65 years old and retired and living on that fixed income, most likely you'll be paying $144.60 per month. Now that's each. So if you have a spouse, you'll be paying double of that for your health insurance. A lot of times I get asked, hey, well, you know, when I was at work, I only paid like, let's say $100 for family coverage. Well, Medicare is individual. So each of the beneficiaries has their own payment as well as their own co-insurances and deductibles and co-pays. One note for those of you on Medicare Part B and collecting a lot of Social Security or a lot of pensions or just have a little bit more income. Now, the Part B premium, that $144.60 I said a little earlier, is dependent on your tax return showing that you made $85,000 or less 2 years before the year we're in now. So for example, we're in the year 2020. If in 2018 you made a little more than $85,000, most likely your Part B premium will be adjusted a little bit upward due to what's called the IRMA, or the Income Related Monthly Adjustment Amount. Now, if you had questions about that, what that's all about, how do you deal with that, we'll see another video on my channel about that specifically. So now I'm going to go into a little bit more about how Medicare Part B works. So let's say you go to the doctor's office and the visit is $100. So you have to pay all $100 the first time you go, and if you go again, well then you have to pay it $98 and then 20% of the remaining amount. So for this strange example, you went to the doctor's twice, it was $100 per visit. If you're on Part B Original Medicare and have nothing else, you have to pay $198 plus 20% of the remaining $2. Now that's provided you had nothing else done in between that, no labs, no surgery, no x-rays, none of that stuff. But in a bubble, just kind of a like, here we go, how it works example, that is how Medicare Part B works. All right, one more thing about Part B and how it works is there are what's called preventative services. These are services that Medicare deems are necessary to help prevent illnesses. These types of services are covered at 100% even before that deductible. So there's what's called a Welcome to Medicare visit and an annual wellness visit. Both of those visits are covered at 100%, so you don't have to pay anything. All right, so now who can I go and see? I heard Medicare isn't accepted pretty much anywhere and doctors don't like Medicare. Well, right now I'm going to show you how to do that, how to find physicians and providers right now. Hey there, so what we're going to do right now on the Medicare.gov website is just figure out how to find a physician that accepts Medicare Part B. Now, we're on the Medicare.gov website. Here it is, Medicare.gov. And what we're going to do is go a little bit lower here to the binoculars and set Find Care. Here we can find things like your long-term care hospitals, nursing homes, dialysis facilities, hospice, hospitals. But today we're just going to go over the doctors and clinicians and find the ones that are nearest to you. So you just type in your zip code. For myself, I'm in Hawaii. So I'm typing in 96817. And you do have to put in here some kind of name or a specialty or condition in order for the search to go through. So I'm just going to type in here family practice, so that way we can get some kind of results. So within our 15-mile radius here, we are able to find about 300 physicians. Now, here we can toggle the distance, toggle the gender. Now, this is the most important bar here. We have to actually, interestingly, it's not already selected, but you have to select this one because these are the physicians that accept Medicare approved amounts. It's also called Medicare assignment. And here, you can go ahead and find all the physicians that accept Medicare. Last thing, Medicare Part B penalties. How do I avoid these penalties? What do I do if I need help? I don't remember having to pay for these before. Why am I subject to these penalties? Well, here's what you need to know. If you are 65 years and are in the US, you have to register for Part B of Medicare unless you are working at a job that provides you with credible coverage. Okay, so credible coverage just means that it meets Medicare standards and Medicare agrees that your coverage is credible. If you have questions about your particular health plan, please ask your benefits coordinator, HR person, or the boss. One more note on that. If you are over 65 and you're going to apply for Medicare, make sure you have your employer complete the credible coverage form linked below on the Medicare website. Now what that does is it proves to Medicare that you have had credible coverage for the entire time from you were 65 until you're applying. Now, here's the fun part. If you switch jobs or insurance between 65 and the day you apply for Medicare, you will need all of that. One more thing on the penalty. If you do not agree with the penalty assessed on you, let's say you had coverage till you're 67, but you forgot to enroll and you start when you're 68, so your penalty is for 1 year. But Medicare penalizes you for 3 years. There is a way to appeal that penalty and to get a reconsideration. And I've linked that as well down below directly to the Medicare.gov website. If you feel like this is helping you better understand your Medicare, consider liking this video and subscribing to my channel for more up-to-date information like this. Thank you so much for watching to the end of the video. If you found this video informative, educational, share it with your friends, like the video, and of course subscribe for more videos just like this on understanding your Medicare. Mahalo, and you have a magical day. Bye-bye now.